on this webinar. As you can see and hear, probably this webinar will be recorded. The webinar today is focused on a very specific topic, that is child safeguarding and child participation, but in the context of Barnahus. It is part of a series of webinars that is organized as part of the Promise 3 project funded by the European Commission. We already have organized 3 webinars, and this is the 4th on the row. And as you can see, for this webinar, it will be recorded and you can find it uploaded in the ChildHub page, or if for everyone that is interested to see afterwards the recording. Of course, being a EU-funded project, this is not the content of the webinar, is not reflecting the official positioning of European Commission on the topic, but is mostly oriented towards the professionals who are working in the Barnahus settings. As I was introducing it a bit, is aimed mostly for professionals who are working in Barnahus similar settings. And today I have the pleasure of having Mrs. Aoife OMalley. She will be sharing with us her practice, but as well her recommendations and tips regarding how they have been doing child participation and child safeguarding in Tusla. The Barnahus there, and of course, at the end of the discussion, of the conversation, we'll be having a Q&A session, so you can write your questions specifically, and of course, I will be directing them to Aoife. But as I hope everyone is able to listen well to us and everything is functioning well. So a bit about Aoife, that I am pleased to have her today. So she's the manager of Barnahus West, and she has an extensive experience actually in terms of clinical lead of the Barnahus therapy team. And she has been the one that has been establishing this service. She has a clinical background in occupational therapy and has developed specialization in working with children who have experienced trauma. She has been chairing the Barnahus West Participation Working Group, which developed the Barnahus Participation Strategy aimed at implementing the Lundy model of child participation within the pilot. She also sits in the European Barnahus Network on Child Participation Working Group. Today, Aoife will be introducing Tusla. So, Aoife, if you can, I introduced you, but if you can introduce to the participants, Tusla. Thank you.
Hi, Alketa. Thank you, and thank you everybody for having me. Delighted to be here. So as Alketa said already, I'm the manager of Barnahus West. So we are an interagency service, and we work specifically with children who've experienced sexual abuse and their families. We're based in the west of Ireland. So we cover basically the whole west coast of the country, and we're the pilot project for Barnahus in Ireland. We are co-located with the forensic medical services, so we're working very closely with them, and we work with the police also here in Barnahus. Tusla is our, I suppose, lead agency for Barnahus in Ireland, and Tusla is the agency with the legal responsibility for child protection and welfare in Ireland. So that's they would employ child protection social workers and so on, but they also employ many of the Barnahus staff and therapists that work with children who have experienced trauma. So I'll talk a little bit, I suppose, about the Tusla participation strategy, but also the Barnahus participation strategy. But just to give you a little bit of background maybe on the Barnahus here in the West, we were launched in 2019. And we became fully operational in November 2020. And we were delighted to open our new premises here in Galway in the west of Ireland in January in 2022. So we're just over a year here. And I suppose we're very proud of the premises because it is largely designed by children as part of our participation strategy.
Thank you, Aoife. But however, you are one of the reasons that I really wanted to have you, and for the audience as well, is to share your professional journey in setting up a Barnahus, especially when it comes to the thorough and comprehensive consultation process that you have been taking. So if you can share with us how this journey was it, and what are the learnings somehow that you had in the process?
Sure. I suppose just to say really that participation is incredibly important in the Barnahus model. We are responding to trauma, and participation is the answer to trauma. When people are feeling disempowered, it's further trauma for them. So really what we do, it has to be at the core of everything that we do, and we really made it part of our journey in setting up the Barnahus here. So I suppose one of the first things that we did when we were setting up the service is we were looking at the quality standards, the Barnahus quality standards, and we really looked very closely at quality standard 1.2, which is around making sure that children have adequate information and that their voice is heard within Barnahus. And we wanted to find a way to make sure that that was something that we really implemented fully in Barnahus, because it is a response to trauma. So I suppose we were looking at that. We were looking at the UNCRC and Article 12, which is around hearing the voice of children, and we were looking at Tusla's participation strategy. So within Tusla, they applied the Lundy model. So Laura Lundy is an academic working in University College Cork in the south of Ireland, and she developed a model of child participation that we felt would apply very well within Barnahus. So it was really important for us to make this an interagency thing, because Barnahus is an interagency model. So we pulled together an interagency team, and I chair this interagency group, and we wrote a strategy based on Laura Lundy's model. So we're looking at the space that the child's voice can be heard. How do we help to hear the voice of the child? How do we make sure that the audience are listening to what the voice has to, or what the child has to say? And how do we make sure that what the child says has influence? So we're making sure that it's really taken on and taken seriously, and we're really implementing change based on what children have to say. So I guess we developed our strategy, and one of the key elements of developing this strategy and writing this lovely document, we didn't want it to be just a document sitting on a shelf. So we went out and we consulted with children and young people to get their feedback on the document itself. And they expressed a lot of interest in the document, in the Barnahus model, and they had a lot to say about what we thought was the best interests of children, but actually there was lots of things that they disagreed with, which was very important to hear. So it really started a partnership with the group of young people to, I suppose, consult with them at every step of the way in establishing the service, but also within the service, hearing what children within Barnahus have to say and so on. So I guess following the development of the strategy and the partnership with young people, we developed an implementation plan, and we continue to review that plan every quarter. So it's really just making sure that, again, the strategy isn't a document sitting on a shelf getting dusty. It's something that we're actively working with all of the time, and we're actively engaging with children all of the time. So I guess the journey for me was a huge learning curve, because I thought I knew what children wanted, but it's really important that actually we hear what they have to say, because they had much better ideas than any of the adults in the room about what Barnahus should look like and the type of service we should deliver and so on. So one small example is in our premises, we don't have any room numbers, because the children and young people felt that the rooms it was too institutional to have room number 1 or room number 10 or whatever. So they assigned astrological signs to each room, and each astrological sign applies to the person or the activity that happens in that room. So my office here is Aries, because the manager has to be able to jump into a challenge, and that's what Aries does. The interview suite is Virgo, because Virgos have very good attention to detail. So it's really important. Like, that's an idea that we never would have come up with as the adults, but the children and young people felt like it was something that was really important. So huge learning for all of us, but really helped us to see the value of hearing the voice of children in the Barnahus.
Thank you. Your journey has been a bit different from the others, let's say, and for myself as well, that I'm aware of how the journey in different European countries that have set up a Barnahus has been going through. why, in your case, you started from child participation, so you started this thorough consultation process with children, but in other countries that we might have participants today in the audience, they don't have child participation, or they don't have the opportunity to have it since the beginning. So why, you mentioned as well why it is important, and you had the legal support that on your side, especially in your specific context, but any other additional elements that you will consider to share why it's important to have child participation within the Barnahus? Maybe if you don't have it at the saying yes phase, how it goes in the next phases of setting up a Barnahus.
Sure. I think it's important that, and again, it's written into the quality standards that all staff are trained in child participation. So everybody, as part of our strategy, but I think it's possible in any Barnahus, is that everybody working with children has a very baseline level of training in making sure that a child's voice can be heard. And that might be something as simple as getting their feedback, but it also is looking at how do we adapt how we communicate with children, and particularly for children with communication problems. We're making sure that their voices are still heard if we need to make sure we have interpreters. We are facilitating children with disabilities. And also, it's very easy to just hear the voices of the adults in the room, but really making sure that if we're putting the child at the centre and we're putting their best interests at the centre, that we're hearing what they have to say. There's a requirement always, I suppose, in Barnahus that there is direct contact with the child during their journey. So again, it's not all the adults talking about what should happen for the child. There has to be a note of hearing what the child themselves has to say. So training is huge. I think challenging traditional cultures is something that every Barnahus can do. And I actually, again, I think it's what Barnahus is really about. It's about challenging the way things have been done before. So maybe just one simple thing, changing the language. So we used to sometimes refer to children who attend Barnahus as patients in the service because they're maybe coming through a medical service. So the patient said, and we say, no, it's the child. So it's shifting the language from patient to child and making sure that that child is personified in the whole process. So sometimes just that language piece really matters, and we can definitely be changing that on a day-to-day basis in Barnahus. The final piece, I think, is around when we do hear feedback from children, that we take it very seriously. So you can have all the tick boxes and the the different forms to children fill in to give their feedback on a service and so on, but actually sitting down and looking at the feedback that children are giving, what they're saying, not only in formal aspects, but in informal interactions, bringing it back to the team and having a real discussion about what we can learn from what children have to say, be it good or bad, and looking at ways to really meaningfully implement their feedback in the Barnahus.
Thank you. Let's move to the other question. You shared a bit about this child advisory board, or this group that you have been setting up. Can you elaborate a bit more on their profiles, their responsibilities? How was the experience for them?
So the Children's Advisory Board almost happened by accident, beginning anyway. So we linked in with a particular group. So Tusla, just to give a little bit of background, Tusla Child and Family Agency has its own participation office, and those officers work specifically to engage with the harder to reach populations. So they work with children from all different backgrounds, and they support them to make sure that their voice is heard in lots of different aspects of society and in lots of different aspects of children's services provided through Tusla. So we accessed a group of young people through the participation office, and it was important also at the time for us to access this group because we didn't personally know them. They didn't have to impress us or tell us anything that we wanted to hear or anything like that. So it was a very indirect link at the beginning. So the young people didn't feel in any way threatened by giving their feedback to essentially a group of strangers. So they could give very honest feedback, which was really important. And I suppose when we consulted with them initially and they heard how enthusiastic we were about child participation, it was them who expressed an interest in becoming more involved in the process. So we met with them directly at that point, and we got their input on lots of different things involved with Barnahus. The young people come from lots of different backgrounds. Like I say, they're often the hard to reach populations, but a very diverse group, which is very important. And we hosted them in Barnahus, so we facilitated to them to come here. and speak to the team and so on, and give their input into the premises. We applied also in partnership with them for the Investing in Children Award. So this is an award offered by Tusla that supports child participation. And the award was presented to them by the Ombudsman for Children here in the Barnahus. So again, it was about acknowledging the work that they did for us and keeping the momentum going on the work that they're doing and the input they have on Barnahus. I suppose the plan next around children's advisory boards is to move into a more trauma-informed space where we're working directly with children who have been through the Barnahus service. We have to think very carefully about this because we need to make sure that it is trauma-informed. We need to make sure that children are not traumatized by providing feedback and giving their input into services. We need to be careful that children aren't harmed in any way by engaging with us and providing their input into the service. So we're working that out at the moment, and we're trying to hopefully contribute to, but also find out more about the evidence base around trauma-informed child participation and how we can do that in the best way possible.
So now, if I understood it right, you are thinking more to involve children who have been going through a trauma, let's say.
Mm-hmm.
But when we speak about participatory approaches, and it is especially for the professionals who are working on this field, how do you think, or what is the impact that have these participatory approaches in meeting the quality standards of Barnahus that we usually refer as the Bible of setting up and maintaining and growing a Barnahus? If you can elaborate a bit more in terms of the impact that those approaches have in the quality.
The impact of child participation in particular, what we're looking at, like I said already, it's a cultural shift. So we are really challenging the traditional ways of thinking that we know what is best for a child. We're also challenging the idea that children lack capacity. I think it's very important that we acknowledge at this stage in the Barnahus, but also in society in general, that children have the ability to comment and to have thoughts and feelings about their own situation, and that needs to be listened to. So that is huge, and I think we need to really model that for wider society and make sure that they see that we can assume that children are very capable, and not have to prove that they're capable, that we're taking that as the given. And if there's a difficulty, it is up to us to adapt, to try and hear that child's voice, rather than expecting the child to upskill in having their voice put across. So I think that's a huge impact, is around that modeling and that cultural shift. I think as well, when we're working with children who've experienced trauma, like I say, it is a response to trauma. It's really important that children are empowered. They have experienced something that has been very disempowering for them. So we need to make sure that the intervention that we provide through Barnahus and all the different parts of Barnahus, not just therapy, is empowering for the child, and it's guided by the child, and that they feel in control of things, because what they have experienced has made them feel very out of control often. So we need to provide an answer to that.
Thank you. Well, this is really insightful, especially if we see it from the practice of empowerment and disempowerment, for sure. Why it's very important to have this shared from your side, considering your experience, is really further continuing on the discussion, on the professional discussion regarding empowerment opportunities, especially when you work with children who are victims or witnesses of trauma as well. When we started this series of webinars, we thought specifically to see, as Barnahus, it is considered one of the best models when it comes in Europe, but not only for ensuring that specialized services provided to children, how safeguarding specifically can be seen within or considered within the forums of Barnahus. So the previous webinars were mostly seeing child safeguarding within the child protection room. We focused on the medical examination, mental health, and psychosocial support. But with child safeguarding, just for the audience that is listening to us, we refer mostly to the organizational responsibility to make sure that children are prevented from being subject of different harm, but as well there are measures taken in order to respond to any kind of concerns. And as part of this project, we have been elaborating what is the safeguarding policy in the Barnahus and so on. But why child safeguarding and child participation and how they come together? In order to understand better this, I would like to know from you, how is child safeguarding practices embedded in your organization in Tusla, and if you can introduce them to us.
Sure. So I suppose in Ireland, child safeguarding is legislated for. So we have it in our legislation that every service working with children must have a child safeguarding statement, and it must be on display within the service. I suppose being Barnahus, we are 3 agencies, so we have 3 child safeguarding statements throughout the building, each one for each of the 3 agencies involved in the service. From a participation point of view, just little things, making sure that the statements are at child height, so children can actually read them if they want to, that they're accessible to children, that they're brightly coloured, they're in appropriate font, you know, so all those things are really important to make sure children have access to the correct information. From a safeguarding perspective, that is, and again, it brings us into the participation piece. Information is probably one of the key aspects. So making sure that children have information about what will happen if there is a risk to them, who they can speak to, what's going to happen if they make a disclosure, and so on. So it's very clearly stated what our commitment to them is as an agency and as the 3 agencies in the Barnahus. Parents also have access to that information, so it's very important, it's very, very clear for them. But I think as well, having this strong safeguarding element in the Barnahus is also very important for all of the staff working here, because like you say, maybe historically child safeguarding fell to one particular profession, very often child protection social work, but actually recognizing, because we have these statements throughout the building, it's the responsibility of every member of staff to be involved in safeguarding of children. While there might be one point of contact that you go to if there is a problem, everybody is responsible for keeping an eye on what's happening for children, for assessing risk, for identifying harm and reporting it appropriately. So it's very clear, nothing gets passed on to somebody else. It's very clear that everybody has a role to play when it comes to child safeguarding in Ireland.
And have you encountered any challenges so far, especially when it comes to the do no harm principle, and how you make sure that through the interventions that you are planning, this do no harm principle is prevailing? And specifically considering the profile or the target group that you are working with, is it mostly are children who are going through trauma or witness?
Sure. I think number one, on the child protection social work side of the house, they use the signs of safety model. So that's something that's been implemented all the way across Tusla, but it requires staff to identify potential harm to the child. So it needs to be named and needs to be put in black and white. What is the potential harm here to the child? It's not just abuse has happened, it's that this abuse has affected the child in certain ways. So it's really about delving into the impact of what has happened on the child, which is really, really important to name. And that's required in our referral form, actually. The other piece I think is really important is to remember any professional intervention is never neutral. So we're either doing harm or we're doing good. Sometimes you can hear people say, it would be no harm if they, you know, or it would be no harm if we, and we actually don't know that. We have the potential to do harm as professionals and as agencies. And I think that needs to be named and talked about a lot. And a lot, again, it's about a lot of the adults making decisions for the child. I think you should. We think you should, rather than what do you think? Would it be helpful for you? Really hearing what the child has to say. We can all have our opinions and ideas of what children need, but actually hearing what they need and where they're at is really important. So I really think identifying that nothing is neutral is important. Also, I guess we're working in a culture where evidence-based practice is very important. So obviously we need to refer back to the research. It's very important that we use evidence-based practice, but also we need to recognize that the evidence base for the evidence base is not very good. So we need to be sure that there are gaps, I guess, and we need to be sure that we're finding an ethical way and a very appropriate way to respond to those gaps in the research. Where there is a lack of research, it doesn't necessarily mean that you do nothing, But again, you're treating the child as an individual. You're not putting them into a box of this particular, you know, research or this particular diagnosis or anything like that. It's about hearing what the child needs, what's their individual situation, making a very individualized assessment. You need to use your knowledge of evidence-based practice, but you also need to fill in the gaps with what the child has to say, what the family has to say. And again, like I say, moving at their pace is really, really important. So that do no harm piece in relation to research and evidence-based practice, I think, is really, really important. I think the final element around do no harm is vicarious trauma. So looking at how the staff that are working with children, and also I suppose the professionals and the families working around children, can also absorb aspects of the trauma, and that trauma can affect the professionals and the families working around children and being around children. So looking at that, looking at how that might be influencing our decision making and how we're being guided. Are we working off evidence-based practice? Are we working off what the child has to say, or are we working off our own emotional reaction to the situation? So it's very important that we use reflective practice to look at our own vicarious trauma. There's no way we aren't absorbing what we're witnessing all the time with these children, but it's not up to the children to respond to our needs. It's up to us to respond appropriately to their needs. So we need to really engage well in reflective practice and be very aware of the impact that trauma has on the wider system that we're working in. And how that even affects how we work as an interagency group. Is there splitting within the group? Are we aligning with somebody other than the child, or maybe are we aligning with the perpetrator? Like, we need to be really, really careful and really naming psychological issues that can be impacting on the team when we're working with families and children who've experienced trauma.
Thank you. Well, when we started to discuss about child participation and safeguarding specifically, we have been like when we speak about child safeguarding, is mostly people think, and professionals sometimes, it is about having policies and procedures in place, and just is really the tick the box exercise. And if we have those in place, we are protected and children are safe. But your reflections were so important, especially on how the do no harm principle is actually affecting even the professionals. And here we'll not be elaborating on the safeguarding for professionals working in the Barnahus, which is another big field of work, of course, to consider. But it is important as part of the safeguarding culture of every organization, and Barnahus included, to strengthen their safeguarding culture and mechanisms, but as well shifting and changing the mindsets. But Aoife, what do you think that are some of the risks that link specifically to child safeguarding that you have encountered or are encountered in the Barnahus setting?
Sure. I know this is probably a typical answer that anyone would give, but information sharing and data protection are huge issues. And I suppose in particular in Ireland, data protection is a very hot topic, I guess. I think it's very important that we're sharing information that is in the best interest of children, that the information that we share is accurate. And like I say, we're not putting our own spin or our own interpretation on the information that's provided to us, that we're providing information to the team, and then we're having a discussion about the interpretation and our assessment of that information. So that's really important. I do really think that Barnahus needs to have almost a special place in society for information sharing between agencies. It should really be facilitated as much as possible with legislation, policies, procedures, and so on, but also with the interagency team, and making sure there's good relationships within the interagency team to share information for children. I think that's a huge challenge for child participation and child safeguarding. I think another area is competing priorities. So I think each of the agencies working in Barnahus, they all have different ideas about what a child might need, and everybody thinks that their own bit is the most important bit, of course. So it's very important that we come together and we discuss those things. And we also keep the child at the center. So it's not about following procedures, and it's not about ticking boxes. It's really important that we remember always there's a child in the middle of all of this, and that we're discussing a child with, a real life child with a real life, and that needs to be kept in the middle. And everything that we do and every decision that we make for the child and with the child is going to affect that child. So we really need to take it very, very seriously. What else? I think as well, like I mentioned earlier on, the assumptions that we can all make about what a child is capable of. I think we need to be really conscious that children have more capacity than society probably gives them credit for. Children are very capable of expressing their opinions, even if they express an opinion not to express an opinion, that needs to be respected. Children who don't give us anything, that give us silence, that's also an opinion, and that needs to be taken on board. So I think they're all really important elements. And again, it's not to jump to conclusions about what a child needs, but really hearing their voice and challenging our own assumptions about what a child is capable of.
I will be playing a bit the devil advocate. So for someone now, like I would like to hear your feedback on that. So someone that might be not very very in favor of child participation and knowing the purpose of Barnahus, that is really to prevent re-traumatization of a child who have been experiencing trauma, might think that having children participate in Barnahus, but in all the decision making, is contributing to further re-traumatization. What would be your arguments to convince that actually this is not the case?
Sure. That's where I think that trauma-informed child participation really needs to be considered. So we need to really build the evidence base around making sure that children are not traumatized. I don't think there's enough research in this area yet, and I think we really need to work on that. So making sure children aren't traumatized by pulling them back in and supporting participation and so on. I also think it's about moving at the pace of the child. So having a professional that has a good relationship with the child, hearing what they have to say, making sure that that professional is involved in reflective practice so that they're really able to put boundaries on their role and, as I say, move at the pace of the child and not push them in any particular direction. Something interesting that we're doing in Barnahus in the West at the moment is we're developing a role for a child advocate. So the advocate will have a role specifically to act as the voice of the child, purely bringing the child's words to the interagency team, or maybe facilitating the child themselves to attend the interagency team if that's what they think. And that advocate might have to come back to the team and say, no, do you know what? This is traumatic for the child to have to do. They don't want to be part of this. And they will be the ones who will act as the voice of the child to maybe protect them from the participation process if it's something that's potentially doing harm. So it's an exciting role. It's very early days yet, but I do think that's something that will help for that person who's challenging the child participation element of Barnahus. I think having that particular person with specialism in hearing the voice of the child, it'll be very important for that role to be communicated to that person. And then again, like I said, building on the evidence base for trauma-informed child participation will be important.
So what would be your final thoughts and recommendations, of course, for the colleagues that are in terms of child participation and safeguarding as well, that might be at the initial phase or setting up a Barnahus, kind of a consolidated phase that they would like to embed child participation practices, and someone that is maybe quite advanced in terms of child participation and maybe keen to learn more about this new role of the child advocate. So those are the final reflections from your side.
I hope I can remember everything in your question now. So the first thing really, I think if you're at the early stages of setting up a Barnahus, really keeping that child-centered approach at the center of everything that you do. When you're being child-centered, it's more difficult to go wrong, I guess. And not only are we listening to the best interest and thinking about the best interest, the voice needs to become alongside that. So child participation really needs to be a key part of child-centered practice. Like I said earlier on, I really think we need to protect the Barnahus as the safe place for information sharing and for child-centered decision making. And Barnahus needs to hold a really special place in society around that for safeguarding it, but also for participation. But something again I learned from implementing all of these participation strategies and practices is that it's very important that there is psychological safety within the interagency team, because if the interagency team and the members of the team don't feel heard, they're much less likely to hear the voices of the child and the families that we're working with. So not only are we working directly with the children and families, it's really important that we work hard as an interagency group to make sure that we all feel safe within our interagency team and that we feel like we can have our voices heard in the correct forum too. So that's just the tip I would give to somebody who is starting out in the Barnahus. But I guess for those who are maybe further down the road, I would really, I suppose I highly recommend the Lundy model and applying that model to the Barnahus. We found it extremely useful as a way to think about much more meaningful child participation. Again, not just hearing the feedback and ticking the box, but really creating a space where children's voices can be heard. So you're using your 4 elements. Number 1, you're looking at the space. Not only is it the space, your premises and where the Barnahus is and how that facilitates child participation, but also how do our systems allow us to hear the voices of children when children have to go to court to maybe give evidence? How are we hearing their voices? Are we facilitating them to have their voices heard? Is society hearing what children have to say in general? And are we modeling that for society within the Barnahus? I think the voice that we can give to children is really important, and we need to make every effort that children's voices are heard. And like I say, we need to assume that children do have the capacity to give their opinion and to communicate their thoughts. And even, like I said, if they communicate silence, that is also a communication, so that needs to be heard. Audience, I suppose under the Lundy model, we're looking at the capability of staff. So is everybody trained in child participation? Does everybody have the ability to hear what children have to say? And then the influence, making sure that we are committed to hearing what children have to say and implementing change based on that. So gathering lots of feedback won't mean anything unless we're actually making changes based on that feedback. So it's really important that we do that. And I suppose my final thought really, like I said, is around trauma-informed practice. So we can apply the Lundy model, we can apply child participation practice, we can apply child safeguarding, but we need to view all of that through the lens of how trauma affects children, how trauma affects families, societies, the teams working with children and so on. So seeing how that can affect us, how that can maybe block us from hearing the voices of children, how we can re-perpetrate trauma by not hearing the voice of a child. And again, like I said, using really reflective practice to ensure that we are not causing further trauma to children by not hearing their voices and not reenacting the trauma for them by not hearing their voices. So I do think the next step for us in the child participation world is to look at the area of trauma and look at how that impacts on how we facilitate children to have their voices heard.
Thank you. So those were the questions that I had prepared with the thinking that might be as well issues that the audience is interested on hearing more. And thank you, Aoife, for all your reflections and practices shared. Now I would like to, so you have the Q&A chat that you can write your questions. I don't know, do we have any questions so far that we can read? And please, if we don't have questions, please start to write those and we'll be able to discuss it with Aoife.
We have one question so far from Rashi. It's so amazing that the Barnahus model is being further strengthened at Tusla through child participation. It is so inspiring to hear of the wonderful work and learn from it. Is there a published document, resource book, research piece that we can read to learn further? Thanks.
Sure. We have our own participation strategy. So if people are interested, you can just email me, aoife.omalley@tusla.ie. I think it's down here. So we can send that on. Also, the Tusla participation strategy, so that's the child and youth participation strategy, is up on the Tusla website. So that's tusla.ie, and you can search for a child and youth participation strategy. It's widely available. I also, like I said already, I highly recommend Laura Lundy's research and all of the work that she's done in developing the model and showing how it can be implemented in lots of different settings.
And maybe just to add on that you have as well a specific piece of work that Laura Lundy has been working on, adapting her child participation model to the Barnahus context. And this is I will be able to post it as well in the chat, but it can be easily found in the barnahus.eu webpage for everybody that is interested to hear or read more about this, and it's really contextualized to the Barnahus context. Any other questions from the participants?
There's
things that you would like to know. Yes,
Greg. Are there any specific ways you bring the child's voice into the interdisciplinary team's discussion, decision-making, and case planning?
Yeah, so at the moment, it's not as strong as it could be. So we always make sure that, like I say, somebody has contacted the child before we meet as an interagency group, and that there is some input from the child, but at the moment it's done through the various professionals working with that child. We hope that when we have the advocate role fully developed, that they will be the person who's bringing the direct voice of the child with no professional interpretation to the meetings, and also hopefully facilitating the children if they want directly to attend those meetings and have a voice directly in those meetings if they felt like it would be helpful for them. So we really want to strengthen that aspect of our participation practice.
So there are more questions coming in. That's great to see. Adlir, hello everyone. I'm Adlir from Albania. What was your experience like in the beginning? How did you make all actors involved in the Barnahus system?
I always remember the quote in my head. It's something like, if you want to go far, go alone, and if you want to go if you want to go fast, go alone. If you want to go far, go together. So it's slow. It takes a lot of time and a lot of patience. We're very lucky to have a really enthusiastic team in Ireland, and everybody really wanted to be part of the Barnahus model. So it was really important that we set up the participation group as an interagency group, and that everyone could feel like their voices were being heard when it came to child participation, that everybody could contribute equally to what we were developing. And it was also an education for the interagency group around child participation, what each of the agencies sees as important for child participation. So those early days, there was a lot of discussion, a lot of really trying to drive things along, a lot of setting goals and trying to achieve them as a group, setting deadlines, trying to work in pairs and work in small groups to get things done, but always trying to make it interagency so that everybody had buy-in to child participation. I also think training was a huge element. So making sure that everybody has a good idea of what participation is about and what is best practice when it comes to child participation was very important, because we can't assume that people understand it. And like I say, everybody is coming from a different professional culture and a different idea what child participation is. So giving that baseline understanding of how we hear the voice of the child is really important.
Thank you. Any more questions?
In the meantime, I'm seeing Narketa. So there was a question about the link for Laura Landy's model to child participation. I see you have answered that.
Yes. So it is the link accessible to everyone? Yes. I just sent it in the chat. You did?
I checked it. It's yes.
Yes. Okay. Good. So we have another question. No, I see Denada from Albania. So Albania, I see some colleagues that they joined that are at the initial stage of setting up the Barnahus. They have staff recruited that they have started, and I'm happy to see them joining the webinar. Is this, we have a question from Denada, or it is just saying hello to everyone, because I cannot see the full text? No, I don't see anymore.
No question so far.
Okay. Okay. Thank you. Just hello. Hello. Well, so if we don't have any more questions, I will strongly recommend you to see in the two pieces of work, the two researches that have been published, and you can find it in the link. And of course, the recording of the webinar with Aoife, it will be available. We both hope that this was useful for you. And I would really like to thank Aoife for her reflections and sharing her practice. Is really appreciated. And I know that the work that you have been doing and seeing exactly, we have seen the children that you have been working with in the Barnahus Forum, and it was really, really good. Thank you.
Thank you very much.
Thanks a lot. So I see someone, Simona, saying, okay, we have, questions. Okay. Okay, so
the one is to send the link because it's not visible. I will repeat it management. The question is, how do you ensure the decision making is taken into consideration, that an interdisciplinary team is in place and many professionals are involved?
How do I ensure decision making is taken? We have very regular interagency meetings twice every week, and we discuss every single case individually. Everybody at that meeting has a voice, and we always agree as an interagency group, and we come to many debates, but also many agreements around what is in the best interest of children. Sometimes the outcome of that meeting is to go and ask the child, and that is something that we will very often do, and we'll allocate that task to a particular member of the team. But it's just making sure that everybody has a voice, that decisions are properly documented, and that everything is coordinated so that the child's experience of the different services is not confusing or re-traumatizing. There's lots more to say on that, but you might need to email me because there's a lot of detail.
Thank you. And as well, you can just orient you as well on the quality standards, and you can see the quality standards specifically related to case management as well. Well, thank you to everyone for your questions and participation. We really hope that this was useful for you and the reflections are useful to your work. And sometimes, especially for professionals, we don't find necessary the time to pause a bit and reflect on the different aspects of our work. And I really would like to emphasize what Aoife said, that evidence-based is so important, but as well to try to research more and do more research on specific topics like child participation, especially in how it affects trauma, and working specifically with children who have been going through trauma is another another field of research, potential research. So I will close if we don't have any. I'm just watching the chat. If we don't have any other question, we'll close it today, and please, we welcome you in the next webinar that is actually on Friday, when we'll be seeing child participation in the same time within the forensic interviewing room in the Barnahus. Thanks again, Aoife, and wishing you have a very good rest of the day to all.
Thank you. Bye, everybody.
Thank you. Bye.